Vertigo treatment. Vertigo and dizziness in the elderly. The prevalence of vertigo and dizziness in people aged more than 60 years reaches 30%, and due to aging of world population, the number of patients is rapidly increasing. In the elderly, common causes of vertigo may manifest differently, as patients tend to report less rotatory vertigo and more non-specific dizziness and instability than younger patients, making diagnosis more complex. Although the causes of dizziness in older people are multifactorial, peripheral vestibular dysfunction is one of the most frequent causes. Benign paroxysmal positional vertigo is the most frequent form of vestibular dysfunction in the elderly, followed by Meniere's disease. Introduction. The terms dizziness and vertigo cover a variety of symptoms regarding disorders of spatial orientation and motion perception, such as the illusion of rotatory motion, classical rotatory vertigo, or the feeling of unsteadiness, which can affect objectively the ability to achieve a stable gaze, posture, and gait. Altogether, they represent a common and serious issue in the elderly, where its prevalence reaches 30% beyond 60 years of age, while rising to 50% beyond 85 years. The sole presence of dizziness in the elderly is a strong predictor of falls. Moreover, the presence of abnormal balance tests increases the risk of hip and wrist fractures. Injuries related to falls lead to mobility restriction and loss of independence, and increase the fear of falling, which also predicts subsequent falls. In addition, falls are the leading cause of accidental death in persons older than 65 years, while dizziness is one of the strongest contributors to the disability burden after age 65. Dizziness in the elderly remains a difficult subject, given the underlying factor of vestibular impairment due to aging in the form of presbystasis. The diagnostic and therapeutic approach must be multi-systemic and oriented to the visual, proprioceptive, and vestibular systems. BPPV and stroke, particularly in acute syndromes, should always be considered, given the frequency of the first and the severity of the latter. How to heal vertigo and dizziness. There is a natural way can help to stop your vertigo and dizziness at home easily. With the program you can know the root of the problem and no longer suffer from dizziness and other symptoms of vertigo. Please take action by click the link here https://vertigo-dizziness.healyourpain247.com